So I'm going to be performing a physical assessment. I've already introduced myself to the patient, let them know what I'm going to do. I've performed hand hygiene. So I'm first going to check for any immediate signs of distress, which he has none. And then going to check his level of consciousness, his appropriateness to responses, his speech, his orientation by asking him if he can tell me his name, if he can tell me what year it is, if he can tell me why he's here and where he's at. Everything looks good there. Then check his facial expressions as well. Everything looks normal. I'm first going to take a look at his head and scalp and face here. I'm going to check for hair alignment, color, and symmetry, no lesions. Everything looks good there. I'm then going to check his ears. I'm going to look at them bilaterally, check for the shape, size, any lesions. I'll then take a look at his eyes here. I'm going to check for any edema, the alignment, the color, any lesions or drainage or anything. Everything looks good there. I'm going to note if there's any assistive devices, so there's nothing for the ears or the eyes. I'll then move down to his nose. There's no congestion or drainage. I'm going to check for size and symmetry for that as well. I'll then move down to his mouth. So I'm taking a look at his lips, his oral mucosa, his hard and soft palate, his gingiva, teeth, noting presence of any dentures, which he has none. So everything looks good there. Then going to move down to his heart and lungs. I'm first going to start by palpating his carotid pulses, and I'll do that one at a time on each side for 1 full minute. Everything looks good. At this point, I'm going to make sure the bed is raised 30 to 45 degrees and that he's in a supine position. I'll take a look at his anterior chest. I'm going to note if he has use of any accessory muscles. After I look at his chest, I'll then locate his PMI, which is the apical pulse. So I'll start by doing that. Count that for 1 full minute. Everything's good there. I'll then take a look and listen at his lung sounds. So I'm going to do 6 in the front and 10 in the back. So we have 1, 2, 3, 4, 5, 6. Everything sounds good. And do the back. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Everything sounds good there. I'm then going to take a look at his upper extremities here. I'm going to note the temperature for each. Before I move on with that, I do need to ask him if he's having any cough, sputum, any shortness of breath, or dyspnea with activity. Everything is good with that. I can continue on here. I'm going to check his hand grasp in both right and left arm. Check for temperature. Checking for any lesions or anything. I'm then going to assess both the right and left, his brachial pulse, his radial pulse, and then check his capillary refills. Everything looks good with that. Then going to move on to his abdominal area. I'm going to first inspect, take a look at the shape, contour, make sure everything looks good with that. Then I will auscultate or listen to all 4 quadrants, make sure I hear vowel sounds. Then I'll palpate lightly in all 4 quadrants. Everything seems to be good there. I'm going to ask him how his appetite is, if he's having any constipation, diarrhea, any nausea, vomiting. There's no catheter present. I'm going to ask when his last bowel movement was, if he has any urinary complaints. Everything seems to be good with that. So I can then move down to his lower extremities here. I'm going to first assess his femoral pulses in both the right and left, his popliteal in both right and left, his posterior tibia pulses, and then his dorsalis pedal pulses in the right and left. Everything's good. I'm going to check his Holman signs, see if he has any pain when I do that. Range of motion looks good. Any pain? Nope. Also check his plantar and dorsiflexion. No edema, no lesions. Everything looks good there. At this point I have done a skin assessment throughout. I would then check for any tubing, checking to see if he has any IV sites, any NG tubes, tube feeding, O-tube. He has none of that. So I'm going to ask if he has any pain. I'm going to note if he does the duration or location. Can I do anything immediate right now? Do you need anything before I leave? Everything seems to be good, so I'm going to make sure the bed is back down to its lowest position and locked. Make sure the bedside table is close, within reach. The call bell is within reach.